Hello, good evening, and welcome to another show of Fresh, Natural, and Live. I hope you had a great weekend, and we look forward to this special show tonight. Of course, all of our shows are special, but tonight is extra special. We're getting into a topic that I really look forward to learning about, so I'm going to really sit back and be in the students' chair like many of you who are joining in with us tonight. We're going to talk about the science of marijuana. We're going to look at the highs and lows and get some kind of understanding of, this whole thing with marijuana. When I was a kid, my mother would often come to me and say, "Look, son, I don't want to ever see you dealing with any drugs." And drugs, when I was a little kid, the bad kids smoked marijuana. We call it dope. And so this was a taboo. So there's something inside my bones, that's deep inside my bones, that says this is wrong. But I've looked at the science to a certain extent, and I'm going to have to learn about this. My late mother may be turning over in her grave if she knows that I'm doing this show. But tonight we are going to get into the weeds, if you will. We're going to look at this topic of marijuana and really get to understanding. And I want us to be educated on this topic in a way that is both responsible and beneficial to you. There's a lot of stuff out there. There are a lot of people opening cannabis shops and the like. And there are a lot of people that are selling CBD oil in different venues. But what we want to do is we want to give you insight and knowledge, and we want to empower you to make the right decision, not only about this drug or substance, if you will, but about any substance or supplement. So I want you to hang tight. And we have a great show for you tonight. So first, I want to bring my elite panel on. We have Isosa, our resident nutritionist, who's here with us today. Hello, Isosa. How are you doing?
I'm well. How are you?
Just fine. Just fine. And we have Celeste, who's going to be joining us also. Hello, Celeste. How are you doing?
Good. Good.
And of course, these ladies were working very hard today, saving lives with patients in their clinics, and we're always pleased to have them join us. We have two very special guests with us tonight, and the first guest is a doctor here in Houston who I just met over the phone. It's Dr. Carly Bell Biggins. Dr. Bell Biggins is a licensed naturopathic physician who specializes in all things holistic, including education, products, and services. Most importantly, she helps her patients feel better. Dr. Biggins practices a lifestyle at Lifestyle 360 Health and Fitness Center here in Houston, in the Pearland part of Texas subdivision of the Houston area. Dr. Carly is also a cannabis educator and offers an online medical cannabis 101 certification course. As CEO of Monaco Natural Health Solutions, she offers free health questionnaires resulting in holistic health advice, health coaching services, and Monaco premium CBD oils. Our next guest, you may remember from maybe a couple of weeks ago, is Dr. Ed Mcdonald. Dr. Mcdonald is a board-certified physician who's dedicated to improving the health of individuals in the community through nutritional education. He obtained his undergraduate education at the University of Michigan and his medical education at Northwestern University Feinberg School of Medicine. He subsequently completed a fellowship in gastroenterology at Rush University Medical Center. Dr. Mcdonald currently is an assistant professor in gastroenterology in the University of Chicago. He is also the associate director of adult nutrition at the university and an instructor in culinary medicine. He has done extensive independent research on the clinical benefits of cannabis and marijuana use, and currently uses it in his clinical practice. I want to welcome to our stage Dr. Carly Biggs and Dr. Ed Mcdonald. Welcome, everyone. How are you doing today?
I'm great. How are you doing?
Just fine, just fine. So I know everybody has had a busy Monday at work, and I really appreciate you joining us. And again, I'm really excited about this show. I mean, I'm going to kind of in part sit back and be part of the audience as much as I can be, because I know both of you have a ton of information. What I'm going to do is I'm going to trade off. Ladies go first. I'm going to ask Dr. Cardi Biggs to tell us a little bit about herself. I know I read the bio, and kind of give us a little bit of quick background as to how you got to where you are and overview of your practice. And then I'll ask Dr. McDonald to do the same. And then what I'll do is I'll just kind of let you guys take over in terms of giving us some insight. I'll try to ask some provocative questions, and we'll go from there. So, Dr. Biggins, tell us, where were you in terms of your practice, and what is the nature of your practice? How do you get to where you are? And just kind of give us a little synopsis there.
Absolutely. Well, first of all, thank you so much for having me on the show this evening. Very excited to be here and have this wonderful conversation around the highs and lows of cannabis. And so essentially, I have been a naturopathic physician since 2008. And from there, just obviously specializing in botanical medicine, I did a lot of research on the endocannabinoid system and the cannabis plant itself and the different phytochemicals within the plant. And the way that I kind of got started down this road of becoming a cannabis educator was I was actually sought out on LinkedIn by Dr. Levery Davidson. She's the owner of the Houston Academy of Cannabis Science. And she wanted me to come in and teach a course on the endocannabinoid system. So I said, sure, I'll come in, teach the class. And it was so much fun. I have a history in adult education as well. I've taught many courses, but this was just a lot of fun. The course was very engaging. And from there, I just started to get invited to speak at various hemp conventions and cannabis conventions around the state of Texas, Georgia, and various places. And even CBD dispensaries here around town, which many of them are owned by pharmacists, which is very interesting, coming in and speaking with them and their customers about the medicinal benefits of cannabis. And from there, I just developed a course in cannabis. And then that kind of turned into my own CBD line. And then I started practicing, like you were stating, here in Pearland, and incorporating CBD for the patients that it's appropriate for. And so that's kind of how it all began. And it's definitely been a journey, and it's a very exciting time in the world of cannabis as well. I'm very excited to be a part of it.
Wow, that's great. As a young kid would say, that sounds very dope. But so Dr. McDonald, you got us in this mess a couple of weeks ago. We were talking about colon cancer, and one of our, I don't think I shared this with you, but Les and Sosa knows this. One of our regular panelists who always asks a question about marijuana. I mean, every session we get the show, I just partly and I wasn't quite joking, but just Lucy threw the question up there. I said, well, what is he going to say about this? And I just threw it up. Oh, yeah. And so you went off with a little mini dissertation there. And so that was the birth of this show. And so, again, I've shared with everyone, my insight has been very limited, other than my mother, jumping my case when I was a little kid. Not that I never thought about drugs. She threatened me so much, but anyway. So, but tell us, you're a gastroenterologist. What brought you into this realm of using cannabis or marijuana, medical marijuana, in your practice?
That's a great question. And like many things, it's really my patients. I'm here in Chicago, and in Illinois, medical marijuana, medical cannabis just was legalized not too long ago. But prior to that, I remember practicing, and me as a gastroenterologist who specializes in nutrition, I see a lot of people with cancer. So I'm the person, if you have a small bowel obstruction because of a tumor and you need IV nutrition or tube feeding and whatnot, like I'm the person that population sees. And subsequently, a lot of my patients are on chemotherapy and a lot of drugs with nausea as a side effect. So I remember seeing people who were trying to get medical cannabis before it was legalized, and they were getting it illegally. And like the image of someone with cancer who's lost all their hair, standing on the corner trying to get marijuana to help their nausea, that impacted me, and I thought that was ridiculous. So once things became legalized, I decided to do more research and actually decided to start prescribing it. And I started prescribing it to a lot of my patients who were already at that time on a lot of opiate-based pain medications that are associated with, increased risk of mortality. And I was able to get a lot of those patients off some of those medications and use cannabis as their primary source of pain relief and or anti-nausea relief. And then from there, I started looking more into literature in terms of there's a lot of studies that are looking at medical cannabis and its role with inflammatory bowel disease. And so for me as a gastroenterologist, I see a lot of people with Crohn's disease and ulcerative colitis. And there's definitely some studies and evidence that indicate that support its use in that population. So I tried it and patients started doing well. Then there's also literature of how it can affect just the gastrointestinal tract in general. So there's some studies that have demonstrated improvements in patients with irritable bowel syndrome. So I actually shared some of those studies with the director of Illinois Department of Public Health. And subsequent to that experience and some of our conversations and going back and forth between the literature, we got irritable bowel syndrome as one of the conditions that can be covered for medical cannabis in the state of Illinois. And it was a simple, conversation and sharing some literature. But like I literally was a person for Illinois that got cannabis allowed for patients with irritable bowel syndrome.
Wow, that's amazing. So that's quite an extensive course of action there. I mean, there you were with just patients coming in with an experience, and then you started reading the literature, and then one thing leads to another. And getting through a bureaucratic process is often next to nothing. So why don't we do this? We've got the two experts here. So what I'd like to do is, and again, I'm going to take this from a student standpoint, and it's also, Celeste, please chime in with any and all questions you have, but walk us through the biology. We talked about the endocannabinoid system. Dr. Biggins, help us with that and kind of give us an overview. What is that? Where these cannabis receptors are, and how do they work? And give us some biology behind it, and then help us apply the medical aspect.
Absolutely. So the endocannabinoid system is, first, I just want to say, Dr. McDonald, I'm so excited for you, and I'm just really so grateful what you're able to do for your patients there in Chicago with irritable bowel disease, and just kudos to you for that. It's very exciting. Okay,
and vice versa. I'm actually organizing a class for the medical students on cannabis, and I'd love to pick your brain at some point.
Absolutely. It's here to pick. Yay.
We'll share information. You guys want a group text message, so we'll share the information, help you transfer each other's information.
Awesome. Thank you. So the endocannabinoid system is very interesting. So the endocannabinoid system, or we abbreviated the ECS, it is a neuromodulatory system whose primary basis is to establish homeostasis, which we know is balance within the body. And so we see the receptors. We have cannabinoid receptor 1, which we call CB1, and cannabinoid receptor 2, CB2, and they're found throughout the body. CB1 is primarily found in the brain and the spinal cord. However, you do find it in other organs throughout the body. CB2 is primarily found in the peripheral nervous system and on immune cells. But again, you do find those cells in other places in the body. So we see cannabinoid receptors in our reproductive organs, in our gastrointestinal system, in our lungs, in our skin, and all over the body. And so it's a network of neurotransmitters, right? We have anandamide and we have 2-AG. These are our two endocannabinoids that our own body makes. And a lot of people are surprised that we make cannabinoids just like the plant makes cannabinoids. Again, ours are called anandamide and 2-AG. And so we know those are like the locks that fit into the receptors that are, well, those are like the keys that fit into the locks that are the receptors.
So anandamide, anandamide and 2-AG are endogenous
endogenous cannabinoids, yes.
Cannabinoids that's made by our body. So it's endogenous.
That's
so we
correct.
make marijuana in that sense. Okay. All right. I'm taking notes here.
Yes, we make chemicals that act very similar to that, how marijuana cannabinoids would act within our body. And this is why the cannabis plant has an effect on our body. The THC will fit directly into the CB1 receptor and will cause certain things to happen. Now, what's interesting is that CBD does not sit directly inside of the receptor. CBD does a lot of different things. One of the things that CBD does in interacting with the ECS or the endocannabinoid system is it inhibits an enzyme called fatty acid amide hydrolase. And this particular enzyme is responsible for breaking down anandamide. Now, ananda is Sanskrit for joy or bliss. And so anandamide is really one of our feel-good hormones. It's oftentimes credited with the runner's high, how you feel really great after a good run. Anandamide levels are very high. And so what happens is when CBD inhibits the enzyme that breaks down anandamide, we see anandamide is going to hang around longer, and we have those joy and bliss benefits even longer. What's really interesting is, for example, in patients that have PTSD, for example, we see decreased levels of anandamide in PTSD patients. We also see increased levels of cannabinoid receptors, the CB receptors in the brain. And what the researchers found is that the brain will start to produce more cannabinoid receptors in order to be able to utilize the anandamide that is there, because it's already deficient. So it'll produce more receptors to use what's there.
So it's a typical upregulation. Typical is what we see in other biological systems. You decrease the stimulator and the receptor upregulates. If you increase the stimulator, the receptor downregulates.
Absolutely.
Okay.
Yes. Mm-hmm. And so we also see decreased levels of anandamide in patients that have, for example, anxiety, depression. We'll see decrease also in schizophrenic patients as well. And so there's the other thing about CBD, another thing, there's tons of things, but another thing is that it also helps to stimulate serotonin receptors. And because CBD can stimulate serotonin receptors, they're looking at it as a potential for treatment for addiction, because it is shown to reduce, drug-seeking behavior because of the stimulation of the serotonin receptors. Another thing that's remarkable about how CBD interacts with the endocannabinoid system is that it reduces the inflammatory cytokines that our body produces. And so this is why cannabis is so effective for things like autoimmune disease, where we have an overactivity of the immune system. When we reduce those inflammatory cytokines, we start to see reduction in inflammation, even sparing of the vital organs that are oftentimes damaged in patients that have, for example, lupus diagnosis, for example.
Wow. So this is quite an extensive system, and I can see where this is going, and it's fascinating. And the thing, I mean, the light bulb that went off is the endogenous cannabinoids. I'm going to get that word right tonight. You said a lot about anandamide, but the 2-AG, is there much known about the 2-AG molecule? That's the endogenous molecule. Give us a couple of quick blurbs on 2-AG.
Well, the 2-AG is also really helps a lot with the inflammatory process and the neuromodulatory process. And so when we look at, for example, how patients have benefit from cannabis with epilepsy, for example, that neuromodulatory process that 2-AG is responsible for really helps to decrease that overactivity in the brain as well.
Wow, this is interesting. Let me do this, and thanks for that background because this helps out tremendously. Ed Zoro asked this question about how is cannabis administered to someone with IBS? Do they smoke it or take it in some other form? Can you help us with the cannabinoid system in the GI tract and how that works? So Dr. Biggins gave us a great overview of the ECS system. Help us with the GI tract. So with inflammatory bowel syndrome or other GI syndromes, what are we dealing with here?
So she really laid an excellent foundation for discussing, not only how cannabis works within the GI tract, but how it works within the body itself. So the GI tract, just to give you a little bit more background about the GI tract itself, the GI tract is the largest immune organ within the body. So the majority of our immune system is actually housed within our intestines. And another thing that's remarkable with the GI tract is that a significant portion of our nervous system actually exists within intestines. So we have our own intestinal nervous system. We call that enteric nervous system. And that actually has more neurons in it than the spinal cord. So another place in the body that has more nerves than your gut is your brain. So knowing that our CB receptors are actually within the peripheral nervous system and also our central nervous system, and knowing that there's communication between the enteric nervous system and all the above, makes the gastrointestinal tract a prime target for modulation with cannabinoids. And also, she mentioned that there's also a lot of immune cells within the gut. So the gut is definitely a site for potential inflammation, and there's a lot of autoimmune conditions that definitely can impact the intestinal tract. So when you think about it, Crohn's disease, inflammatory bowel disease, ulcerative colitis, these are common conditions that can involve severe inflammation of the intestines. So one of the potential targets for using cannabis is basically trying to decrease inflammation within the nervous system, but within the enteric nervous system and also the gut in general. Now, the gut is also responsible for motility. So the foods that we swallow, they have to pass through the intestines and they move throughout our entire body. And that's a process that involves motility, which involves the enteric nervous system. So for people who have severe constipation, diarrhea, or chronic nausea and vomiting, those are conditions in which the motility of the intestines may be disrupted. So there are a lot of people who are looking at using cannabinoids as a way to modulate abnormalities when it comes to intestinal motility. And I think one of the first interventions that looked at, or one of the first symptoms where cannabinoids were looked at as a potential mechanism to affect motility is really centered around nausea. So there's actually a medication called Marinol that we use commonly in the hospital all the time. So I know a lot of times people have, there's a stigma associated with cannabis, but the reality is we've been using derivatives of cannabis in the hospital for many years. And, we just changed the name. So Marinol has been around for a long time, for probably about at least 25, 30 years or so. And it's been used in the setting of chemotherapy-associated nausea, nausea associated with HIV. It also can improve appetite. So that's just one common form that we've been using legally for many years.
How do I spell that? Marinol, M-E-R-I-N-O-L?
No, Marinol is M-A-R-I-N-O-L.
Marinol. Okay. Now, so let me ask you this. I'm going to throw a hypothetical at you, Ed. So you're doing the GI consults, and OBGYN called you to see a patient who's pregnant, and she has hyperemesis gravidarum, and she's failing everything else. And you go and see her. Could she benefit from CBD oil or some form of cannabis?
I mean, pregnancy is complicated, so that I would probably say that's not that's not the fairest example. And you know, my wife, the OB-GYN, would
okay.
she definitely would take issue for me giving out advice to pregnant women.
I understand. Dr. Biggins, you want to weigh in on that?
I do. And there's two things I want to weigh in there for Dr. McDonald just said, but I'll address this part first. I was a pregnant woman with hyperemesis gravida. And I tell you, you know, when my OB-GYN gave me the option of either being fed through a tube or taking a medication that had Parkinson-like syndrome side effects for me, because I said for who? For me or the baby? For me, okay. I turned to cannabis. And I actually did start to take the medication. I didn't like the way it made me feel. And I promise, if I felt a little tick, the first time I felt a little tick, and it could have just been in my mind, I don't know, but I was like, I'm not taking this medication anymore. Hands down, the most effective treatment, more than any Zofran, I've taken it all for nausea and vomiting. And cannabis, hands down, is the most effective and I believe the safest medication for nausea and vomiting for pregnant patients. Now, I know that it's not FDA, you know, the FDA has not come out and said this is safe for pregnant patients. And I'm definitely not going out there and promoting, you know, that pregnant women should do that. They should definitely talk to their physician first. I'm just sharing my story and what I decided to do and what I thought was safest for me and my child. And it was very effective. And I mean, when I'm saying I was vomiting 30 to 40 times a day.
Wow.
And this was a solution for me. Not only the vomiting wasn't the worst part, it was really the nausea, you know, and just instantly, you know, gone. I'm using cannabis. It was quite remarkable. So I pray that one day we do get to a point where it is recommended for pregnant women who have hyperemesis, because definitely I am a case study. Now, the other thing that I wanted to address was when he was describing the Marinol and how it's not new. And you guys been using it for over the past 25 years. I just wanted to chime in because I also teach about cannabis history. And, you know, before 1937, cannabis was one of the most prescribed drugs in the United States by physicians. In 1937, you know, and I know he was just speaking in, and I know you know that, Dr. McDonald, but I just kind of wanted to share that with the audience because in 1937, with the Marijuana Tax Act passage, is when it became illegal, and they put cannabis, you know, under this illegal status. And really, it was a topic for another day, but it was really a move to criminalize marijuana to put more brown and black people in prison. Okay, and so that's really the story behind it. But before that, hemp itself was used as could be legal tender in our country. People could pay their taxes in hemp. People in the colonial time could be jailed if they weren't growing hemp. There are over 8,000 plantations that were growing hemp. It could be used to make over 25,000 different products. And so it's something that physicians back before 1937 would prescribe for nausea, vomiting, for anxiety, for pain, for all of these things. And this is not something new that we're discovering, we're rediscovering it. And I'm so excited we're coming back around to it. But these are things that have been used for millennia around the world. We have evidence in ancient Egypt, all over India, Asia, all over. And so it's exciting to see the resurgence.
That's fascinating. We're going to have to talk about you doing a show. I want to, Ed, get back to Zorro's question on IBS, smoke it, take it in other form. How do you treat your, is it the oil or cigarettes, or how do we treat the IBS patients, just practically speaking?
So it can be all of the above. So there's not necessarily one route that I would recommend. You know, with the exception of sometimes if people have severe nausea, anything that's edible may be a little bit more difficult to tolerate, at least initially. So that's where some of the sublingual forms, or if they do ingest anything that's edible, I recommend some of the liquid forms that are a little bit easier to digest. But in terms of vaping, smoking, there are a lot of people everyone has their own comfort level with how they, want to intake cannabis. But I've seen success with multiple different routes. So I wouldn't necessarily recommend one route versus the other. And this is, one of the reasons why we need more people prescribing medical cannabis and also asking these questions, because we have to advocate for more research to be done so we can better ask some of these questions on a clinical level. We need larger epidemiologic studies for me to be able to say the best route in this population is. And I mean, we're getting to the point where as more states legalize cannabis, it's easier to do the research and collect some of the data. But some of these questions that you really want hardcore clinical data that require like a pharmaceutical trial, we just need larger numbers, basically. And we're getting there, but in order to really get there, we really need more shows like this to encourage people to become better advocates. And, when you brought up the history of cannabis, to me, there's a justice component into why I'm an advocate for cannabis, medical cannabis, because, there's a lot of Black and brown people who've been in jail, incarcerated for years, decades, for now a medication that people are going to make billions off of. And there's people still in jail right now.
That's right.
And for me, that bothers me. I mean, and it bothers me not only as a Black male, but it bothers me as a human being. Like, I feel like we all should be bothered by people suffering for essentially no reason, for a medication that was once legal and used as a medication, but, for political reasons, for racism, for a lot of different reasons, we just decided to criminalize it. And that criminalization, it's one of the stigmas that still exists to this day. And I still see a lot of patients with cancer who have fallen victim to believing into that stigma. So they'd rather be on medications like opiates, the Laudid and morphine, and deal with constipation and some of the negative side effects, and actually try something that may be helpful, primarily because of believing in this stigma. People still say, well, like, I don't want to try cannabis because it's a gateway drug, but give me morphine. Like morphine, or give me fentanyl. Like fentanyl is a drug.
One thing you mentioned with cannabis, and I'm going to say this. We got a bunch of questions, but real quick, you touched on a point. These narcotic drugs, they theoretically relieve pain, but they cause constipation. Cannabis will relieve the pain, but improve motility. So that's interesting. Here's a question from Pat Lathrop. Assuming not all CBD is created equal, what should someone look for to make sure they're getting a quality product? That's something that
good question.
I have. Cardi, and either one of you, take that away. Just give us a quick synopsis on that.
Sure, I can speak to that. So the first thing you want to do is you want to be able to review the certificate of analysis report. That's the COA is how you typically see it abbreviated. The certificate of analysis report, all CBD companies should be able to supply it. If they cannot supply it, I would recommend that you find another company. The COA will tell you the number or the percentage of the cannabinoid, each cannabinoid that is found within the oil. It'll also tell you if there are microbes present, which there should not be. It'll also tell you if there's any solvents that are present. And they're getting kind of fancy with the COAs now. So some can tell you even other phytochemicals that are present, such as the terpenes. But minimally, you want to see the percentage of the cannabinoids that are present, as well as you want to see non-detectable solvents and non-detectable microbes as well.
Wow.
And what would you consider a good percentage?
Well, so legally for CBD to be sold under the passage of the Farm Bill, right, 2018, that said we can sell industrial hemp products, and that's how CBD kind of came into the boom on the market. It's now it has to be derived from the hemp plant, because we know we have the cannabis family, and under cannabis we have both hemp and marijuana. And so you can make CBD from marijuana, but what we're selling in states where marijuana is not legal, it has to come from hemp. So the THC percentage has to be 0.3% or less THC. And that's going to guarantee that a person does not produce a high. Now, in states like Illinois, right, where Dr. McDonald is, it's going to be different, but just nationwide with the CBD that can be sold in all states, it has to be derived from hemp, and it has to be 0.3% or less THC. Now, with the CBD, you know, you want to see at least 20% cannabinoid there, percentage, but it's definitely going to vary depending on the plant.
Gotcha. Now, real quick, I'm gonna come back to Pat Lathrop. She had a follow-up on the CBD oil, but can Parkinson's patients benefit from CBD? And I want to put Parkinson's / demented patients, Alzheimer's and vascular dementia patients, so kind of lump them together. Can they benefit from CBD, and if so, how?
So Parkinson's patients definitely can benefit from CBD, not only Parkinson's, but multiple sclerosis and other neurologic conditions, including fibromyalgia. So there's been a plethora of clinical studies where they, looked at and really described some of these benefits. So I have several Parkinson patients who are using CBD as an alternative to, again, some of the commonly used medications that we use. And back to your story about hyperemesis gravidarum. With any medication, we always have to think about risk and benefits, alternatives, and et cetera. And that's including medications that we prescribe. And your story about hyperemesis gravidarum, I mean, that is real. Some of the medications that we use to treat that condition can cause tardive dyskinesia, which is a Parkinsonian condition that is permanent if it happens. It's literally permanent. And I've anecdotally seen, women benefit from cannabis. Since, it's not FDA approved in the setting of pregnancy, it's hard for me to, just give it out to everyone as a physician. But when it comes to hyperemesis, that is a tough condition to experience, and it's also a tough condition to treat. And for me and my approach, I typically recommend natural alternatives before we actually recommend medications that potentially can have some long-lasting side effects. And one of the reasons why I recommend cannabis over other medications, specifically the opiate-based pain medications, is that, coming through medical training, and Baxter, you can attest to this, you have to work in the ERs. I've never seen anyone come in, ODing, off of cannabis, the same way they come in with narcotics. Like, I've never had to push Narcan because
that's a good point. Right.
Stop breathing because of some cannabis. Whereas I'm a gastroenterologist, but I can't even tell you how many times when I'm in the ER at the VA hospital as a trainee, where people come in, borderline dead, and we have to give them Narcan to kind of revive them.
That's true. I saw one case. I'm going to say this. There are a bunch of interesting questions I'm going to get to in our chat session, but I'll say I had one case when I was a fellow that actually ended up in a cardiology fellow. And a gentleman came in and into the emergency room. And to make a long story short, he went in just to get an excuse to leave work early. He left work early, went away with his friends. They went to smoke pot. What happened was and I wasn't aware of this until we went through discovery and all and what have you, but they used to use Primatene mist. Primatene mist then was over the counter. So they would inhale Primatene mist to open up the airways. And then when they smoke their weed, they get a bigger high because they ingest more marijuana. I didn't know that until, one of the people explained that. Now, he had a cardiac arrest. We think the Primatene mist may have done it, but he also went into rhabdomyolysis. The electrolytes are off. I did pull an article where there were, I think, a case series of 3 people that had injected marijuana intravenously, and it had caused rhabdomyolysis. Now, that's a rare case. I just throw that out there anecdotally, but I think to your point, Ed, you're right. Other than that, I've never seen situations where people coming in overdose with marijuana unless you use Primatene mist, which could probably cause a cardiac arrest itself, and so on and so forth. Here's a question about prostate cancer from Terrell Archer. Should a person in the early stage of prostate cancer use cannabis?
Yep, I'll touch on that one, and maybe Dr. McDonald like to chime in as well. But I'd say all cancer patients could potentially benefit from using cannabis. And I say that because, I mean, obviously from the side effects of other treatments, the nausea, the vomiting, the appetite suppression that may come, or the loss of appetite that may come with a cancer diagnosis, all of those things it's helpful for those things. Also with the anxiety and the depression that may come with it as well. But the other part of it is that many studies show that cannabis has inhibitory effects on cancer cells. And so there are many studies that show, and there's different cannabinoids that show to be inhibitory for various types of cancer cells. But definitely it seems to be that in a lot of the research with cancer, cannabis is showing some promising effects in inhibiting cancer cell proliferation. And so I would say definitely a prostate cancer patient could benefit from cannabis. What do you think, Dr. McDonald?
Yeah, I definitely agree. I mean, especially when you touched upon the depression and some of the emotional conditions that can come along with having a cancer diagnosis. So, I mean, I've seen people go through chemotherapy. I've seen people kind of battle these conditions. And I mean, it is a battling cancer, especially some of the later stages, stage cancer. It's not only a physical battle, but it's an emotional one and a spiritual one. And I think if there's anything that's going to help relax you and help make that battle a little bit easier, I'm hands down an advocate for it. And I agree, there's plenty of studies that have demonstrated, especially in vitro studies, the positive impact that cannabis can have on cancer cells in terms of being able to, essentially eliminate and decrease some of the cancer cells. So whether or not specifically within the context of prostate cancer, I have to go back and do a little bit more research to say specifically, these studies can specifically affect prostate cancer cells. But there's definitely plenty of evidence that in various types of cancer, there may be a positive benefit.
My first prostate cancer patient had his cancer downgraded in 3 months, and we put him on I put him on a plant-based diet, but he actually was using cannabis, I think, in the earlier part of our treatment, and I didn't know enough about it. I didn't stop him, but then at a certain I just didn't say, you know what I mean? I just didn't say anything. And then at a certain point, I did say something because he also was obese, and he was doing pretty well with losing weight. Like, we had lost maybe 60 pounds at a certain point. And then he said that he felt like it was increasing his appetite. So he would start like binging on dates and like all this stuff. And I was like, okay, you need to slow your roll a little bit. But I don't, I'm not quite sure. Maybe it was the combination of both. I don't really know. I'm very curious if there's been any studies or on like long-term effects. I get that it has these short-term, potentially beneficial effects for certain things, like the nausea and the pain and all that. Has anyone looked at like, okay, 5-10 years down the road, you know what I mean? What could happen to people?
Absolutely. So again, to touch on what Dr. McDonald was saying, we need more research, and I'm going to touch on that about why we are lacking so much research here is because it's on a Schedule 1.
Yeah.
But I am going to answer your question too. A lot of the research that we see, and a lot of it comes from other countries, and when they study chronic cannabis users, what we do not see cancer developing in the lungs in smokers, just like when people smoke cigarettes. We do not see cancer developing from cannabis smokers at all. They think there may even be a decreased risk with cannabis smoking. I've seen some studies to suggest that. Also, we see an increase in neuron connectivity in chronic cannabis smokers. What's really interesting is, or users, I should say, not just smokers, is that, we've been kind of fed this propaganda about, it kills your brain cells, and that could not be further from the truth. It actually promotes neuron growth and the connectivity between the neurons, connections to develop between the neurons, and it's very neuroprotective. And so all of the long-term.
Would it increase BDNF? Sorry. Would it increase BDNF?
Would it increase BBNF?
BDNF, brain-derived neurotropic factor?
I'm not sure. Dr. McDonald, do you know that?
I'm not sure offhand. It's a valid question, though.
Very good question. Yeah, I'm sorry, I'm not sure.
No, it's okay.
But long-term studies do not show negative side effects. Really, the negative side effects that you can really see from cannabis are primarily short-term. For example, short-term memory loss. For example, where did I put my keys? You know, why did I walk in this room? Those types of things are what you really see. You see dry mouth can happen sometimes. Also red eyes. Also sleepiness can be if someone's not looking for that, depending on the strain and what's in there, it can be very sedating, especially certain terpenes that are maybe high like myrcene. But the side effects seem to be very mild and very limiting. And nothing that we're seeing in the research that I've seen so far that indicates any negative long-term side effects. And just really quick, one other note about it being on Schedule 1. Mm-hmm. What does Schedule 1 mean? Schedule 1 means that A, it has no medicinal value, and B, it's highly addictive, whatever the substance is that's Schedule 1. We know that A, cannabis is not highly addictive, and B, that it does have a tremendous amount of medicinal value. So the fact that it's even on Schedule 1 is a lie. And I do a lot of advocating to get it off of Schedule 1, and primarily because we need access for research, because when it's on Schedule 1, institutions have a very difficult time being able to actually get the product to do the research on. There's, I think it's University of Mississippi or Mississippi State, where they are only school that is allowed to grow for research purposes. And I hear it's very poor quality. And so that's one of the barriers that we have in the research area, is it being on Schedule 1.
We're about to collaborate on some things, a couple of things. One, there's a quick insert, and I got us another question from the chat. Dementia. My dad has advanced dementia. Should I give him CBD oil? Yes or no?
So if he has eating difficulties, it may stimulate the appetite. So I've seen a lot of people with dementia who they reach a point where they're eating less and nothing really tastes good. So I've used that just for appetite stimulation. And again, Marinol, one of the medications that we use to stimulate appetite, like we give it in that context all the time.
Gotcha. So now his appetite works very well. I mean, I'm just trying to get his cognition up, but so I guess there's not enough data there.
So, I mean, it's one of those things where we need to do further research, and in general, improving cognition, I definitely recommend trying to get on a plant-based diet. And there's
we got that. We got
mind diet and stuff like that.
No, you're right. I think you're right. Here, back to the panel. Has juicing the plant been shown to be benefit in any way? Marijuana juice. I mean, we got the oil, but I guess, is there a juice extract there?
Actually, I can chime in on that. Yes. Now, here's the thing. Typically, when you think about the effects of cannabis, you usually think about it in a decarboxylated form. Okay. And when you have decarboxylation, the plant has either been dried or heated, because in the plant you have what we call THCA, which is the tetrahydrocannabinol acid. When it's decarboxylated, it converts to THC. Okay. And THC is what it has a lot of medicinal value, but it also creates the high, right? But that's not all THC does. It's anti-inflammatory, does lots of other things too. So what we found is with the THCA, they've been doing a lot more studies on the acid form. And when you can juice it, right? And then eat it in that way, you won't get the high, but they are seeing some benefits to the THCA. And so this is an exciting new area in research, in cannabis research, and they're seeing a lot of the same benefits, the anti-cancer benefits, they're seeing the anti-inflammatory benefits. And so they think that this is actually going to become a very new kind of area where you're going to start to see, fresh juices, because typically, because it's fat soluble, you typically see marijuana or cannabis made into a food that has an oil base or a butter, something like that, because of the fat solubility. And you are going to need that if you're looking for that high. But it looks like the THCA has benefits as well without the high that comes after the decarboxylation. So
basically, the THCA, when heated, converts primarily to THC, which, among other things, creates a high. But if you juice the plant, you maintain the integrity of the THCA, which has those benefits without the high.
Yes, that's correct.
Now, Robert Humber wants to smoke dope. So is smoking cannabis dangerous for the lungs?
So, like she mentioned, like she mentioned that there are studies that have demonstrated in terms of lung cancer, you don't see the rates of lung cancer associated with cannabis smoking that you see with cigarette smoking. And one of the theories that has been postulated is that the actual cannabis may have some anti-cancer properties. So that's why the tar within cannabis does not necessarily lead to the same amount of cancer that you expect to see with cigarettes.
So do you have increased cancer in cannabis smokers compared to non-smokers at all?
So lung cancer compared to...
So like, well, let's say you get 1,000 people, they smoke cannabis, and another 1,000 people don't smoke anything.
Yeah.
What might those population differences show?
I don't know if we've had a study that's been powered enough to actually...
Probably not enough data.
Yeah.
No, that's fine. So let's see. And I'm trying to get, what is the...
Can I ask a quick question?
I'm sorry, go ahead. So
just, what do you, is there any downside to GMO plants for the CBD or THC component?
As far as genetic...
Oh, go ahead, Dr. McDonald.
No, you can go ahead.
Well, are you thinking about like the new strains the new strains that they're putting together that may have a higher THC content? So they're kind of putting together two different strains that normally would not be together in order to produce a new type of a cannabis strain, or is that kind of what you're thinking about?
Yeah. Mm-hmm.
Yeah. So again, I think this is a really new thing that they're doing. I haven't seen any research so far that has said anything negative about, them combining these as far as it being a problem. Medically, I do think it's a problem that they're trying to, I don't know, sometimes some of these strains where they're producing these really high levels of THC, can just be maybe overly intoxicating, for certain people that are just using it for that particular reason, because they're strains that didn't really exist that they're creating in that way. But as far as it having any type of long-term health benefits, I haven't seen any studies on that. Have you, Dr. McDonald?
I have not.
Yeah, the problem with GMO may be like what we deal with GMO with other plants. I mean, once you take the plant out of its natural state, I mean, of course, plants evolve over time, but when we rapidly genetically modify them, I'm not sure if we get the overall health benefits, but I guess time will tell. At some point, we'll get more data on all of this. We have some great questions. Pat Lathrop, he asked, would CBD oil be as effective applying topically versus orally? I guess if you have musculoskeletal pain, I bought some CBD oil from that company you recommended, Ed, and they have a topical and oral, and I've used some of both. So what topical versus oral? I guess maybe you deal with arthritic pain, or what has been y'all's experience?
Majority of my patients, I mean, as a gastroenterologist, majority of my patients are doing oral CBD and oral cannabis. So since I'm not necessarily a primary care doctor or, dealing with inflammatory conditions of the skin or of the joints, I don't really have enough clinical experience to really comment.
Gotcha. Dr. Biggins?
Yes, and so I have patients that are using both oral and topical. And so what I typically recommend, if it's something systemic, or even if it's like an irritable bowel disease, definitely we're going to go oral. If it's arthritis and they're having joint pain all over the body, we're definitely going to go oral. If they just have one sore knee, sure, have at it, rub the topical. But I feel that when it gets inside and begins to circulate internally, you do see greater benefit. But I do have plenty of patients who really enjoy using the topical salves, using the topical lotions, and have relief from muscle soreness and joint pain topically as well. And so, but again, depending on the situation and how widespread, I typically like for them to take an oral solution.
Can I ask a question?
Sure, absolutely.
Because I'm just thinking about long-term effects again, but I'm thinking specifically about the brain and how, like, a lot of times when you meet people who use cannabis a lot, sometimes longer term, they almost seem like they have less drive. And then it makes me think of dopamine. And then I was just like looking it up because I was like, it's like, so what I've seen so far from what I looked at, I would like your opinion, is that it can increase dopamine in the short term, but that they're saying that after a long period of time, it might actually decrease levels of dopamine. I'm curious if you know anything about this or if you have any comments on it.
Actually, and I'll let you chime in, Dr. McDonald, but I just want to jump in right here real quick. They actually just recently did a study that showed that kind of debunked this lazy stoner kind of myth. Mm-hmm. They actually did a study where they looked at elderly population, and they found that the elderly population that was using cannabis was much more active than the community that was not using cannabis. And they think it just has to do with maybe decreasing inflammation, increasing mood, which makes them want to do more things like going out and playing golf, etc. I just have not really seen myself in long-term cannabis patients this kind of idea, because I mean, I know everyone from surgeons to waiters and everybody in between that use, and I really think that what you may see is an exacerbation of a personality trait that may already exist. This is just my theory, because I don't really see people who use cannabis long-term really kind of becoming unmotivated. I think that if they're generally unmotivated, it can exacerbate that. But I see plenty of people who use cannabis that are extremely motivated and active. And so that's been my experience, and that's the research that I've seen. What about you, Dr. McDonald?
Yeah, I would agree. I mean, when you think about motivation in of itself is a very complicated concept. And there's a lot of different factors that go into someone's motivation beyond, whether or not they're using cannabis. So I feel like you're going to, just like with any, any social issue, you're going to see a wide spectrum. You're going to have motivated cannabis users and unmotivated ones. And same with people. There's plenty of people who are unmotivated who just don't use any of this stuff. Just because it's very complicated.
So when I shouldn't have used the word motivation, because dopamine is really, when it comes to like pleasure seeking, where it comes to the, you know what I mean? So it's more like their threshold is now increased to the point where they can't get the same effect from a stimulus.
Right. Where like you need more and more of it.
Yeah.
Dopamine release.
Yeah.
Is that cross-reactivity with cannabis and dopamine?
Say that again?
Is that cross-reactivity with the use of cannabis and certain forms of dopamine receptors? Do you see downregulation of dopamine receptors?
Dopamine release occurs with a lot of different pleasurable activities, including cannabis use. Whether or not whether or not cannabis use alters your dopamine release threshold, I'm not sure. So I mean, it's a possibility. That's stuff that you see with various other drugs where, with say cocaine, you get high with one level of cocaine. In order to get that same high, you got to do a little bit more and a little bit more, a little bit more. With cannabis, I mean, I feel like with anything, you can develop a tolerance to some degree. So there's some people who may say you're doing, and it's one of the reasons why we do microdosing in order to really help people identify, how much is too much. Because if you have too much too soon, that's when you can get some negative side effects and have a kind of a negative experience because it's too much for your body to handle. So for a lot of people who are doing like edibles and stuff like that, the concept of microdosing is extremely important. Because if you want to start off with like 10 milligrams and you're cannabis naive, that's a lot to start off with. And you will probably have a negative experience. Whereas, a lot of people are just starting off with smaller doses, like 2 milligrams or so.
Wow. Is Carlos Haynes wants to know. I'm sorry. Go ahead, Celeste.
I just wanted to see if she would just comment or Ed comment on medical marijuana in pediatrics. I mean, I know about epilepsy and those type of things, but just some of the other the things that probably haven't been proven as much literature. So we know in chemotherapy, same thing for nausea and vomiting in pediatrics, but how about other uses in pediatrics?
I know when I was a kid, it made my backside hurt pretty bad. I mean, that was another mechanism.
So I've used it. So I don't treat pediatrics per se, but I have a lot of patients who have cerebral palsy who, when they transition to, seeing an adult doctor, I'm the doctor they see. So for a lot of my cerebral palsy patients who are in wheelchairs, who may have, spasticity and just a lot of different things going on, because cerebral palsy is very tough. So I've had a lot of parents use medical cannabis to help their cerebral palsy patients. And I'm sure that applies to, the pediatric population too. And that just kind of helps, adult patients and also potentially the kids who are very hyperactive and very agitated and stuff like that, and helps them kind of calm down and relax a little bit. And so, that's the extent of my use within that population. But I'm sure as we get the opportunity to do more studies, we're going to find more potential benefits. But again, this is where we really have to become advocates to really change that Schedule I status of cannabis.
Wow. How would it affect? Carl Haynes wants to know. First of all, the difference between cannabis and taking CBD. But then, does it have a healing benefit in cardiovascular disease? So that's the issue there.
Yeah. So cardiovascular disease. I mean, there's a broad spectrum of cardiovascular disease. I know we use that as a blanket overall term, but there's a lot of different cardiovascular diseases. The condition, the major cardiovascular condition where I've seen a potential.
Oh, we lost him. Whoops, there he is. Go ahead.
Turn that off. There's one study, I think one of my buddies that I did residency with, he actually did the study, where they found potentially an association with cannabis use and atrial fibrillation. So that is the only cardiovascular disease that I've seen. And I think that was using NHANES data. So this is, it's not one of those where you can say cannabis causes atrial fibrillation. There may have been a slight association. So that's the only cardiovascular condition in which I think a little bit about in people who have a pre-existing history of atrial fibrillation. And again, this is something that requires further research to really, clarify and understand what's going on, whether or not there is a real link, or, it's just something that a statistician came about that, may not even be real to begin with.
Okay, so no necessary cardiovascular benefits, but a potential risk of increased atrial fibrillation based on at least one population data analysis.
And then there's definitely benefits in the sense that, majority of cardiovascular disease is going to be an inflammatory process to some degree. It's just inflammation that happens within the vessels. So the potential benefits is, essentially decreasing some of that inflammation. But, are there large cardiovascular studies where, like that exists with the medications, with all the fancy names and stuff like that, where, they're giving cannabis to people with heart failure and looking at outcomes? whether or not it has an increase, decreased mortality associated with heart disease. We just don't have those studies yet.
Gotcha. So the issue is, and we're pretty much at the end of our show, and I don't want to take us too long. We're going to do a part 2 and possibly even a part 3. This is I'm sad I used my dope joke earlier, because this probably would have been the best time to apply that. But the thing is that this is excellent, and the lasting question I have, because there seems, looking at the question, seems to be there's a pull between, okay, is there a risk? I mean, if I use marijuana, if I use the actual cannabis in whatever form, THC, etc. Now, I remember my notes here shows me that CBD oil really enhances endogenous production or decrease endogenous degradation or degradation of endogenous cannabinoids. Would that be a safer form to use, because you're only enhancing what your body naturally makes, and so theoretically there should be less of a chance of toxic effect or excessive effect? In other words, if I was giving you some form of cannabis, pharmacologically, quote unquote, it's a chance that I will mess up by giving you too much, giving it in the wrong form. But if I'm allowing the body to give it to itself, the body knows how to give it to itself and knows what it needs. So theoretically, one would think that's safer. Is that a reasonable analysis, or help me out with that?
Well, I would say that definitely, it's really going to depend on what is the illness and what is the person, really the benefit that we're looking for. But I think for someone that's new to cannabis, as I see there's that question, is there a difference between using cannabis and CBD? Yeah. And I think it's important people to understand that CBD is cannabis, okay? Just like marijuana is cannabis. The big difference is that in the CBD products, we have a very low level of THC. And so for people who are new to cannabis, they typically feel more comfortable, or they can feel more comfortable in taking a CBD product because they're going to get a lot of medicinal benefit. And a lot of people want to avoid that high feeling. And so with CBD products, they will avoid that feeling of feeling high. And in a full spectrum CBD, you still have THC present. It's just less than 0.3%. So you can still get what we call a synergistic effect, where we have the various cannabinoids together. What we find is that when the cannabinoids are together, they work better. And I'm always a advocate for whole plant use, because when you start pulling out, just this active constituent, and we're just, high level of THC, or we're just CBD, you don't see the benefit that you see when you have CBD and CBN and THC working together. Okay, and they call that the entourage effect, or it's really a synergistic effect. So I think a combination product is really going to be what's best, because also CBD helps regulate those high effects of THC. So when you take the CBD, the high that you normally would have here, the CBD can help bring that high down and helps to regulate it. So they're made to work together.
I see. You want the whole plant form of CBD, not just one with isolated. Let me throw a couple more questions and we'll close out. This has been an excellent show, and I've learned a lot. Shelly Jones, I think she has more of a personal question. Is smoking CBD cigarettes acceptable for personal recovery? My son was using cocaine, but in recovery now, he hasn't been using cocaine for a year, but smoked cigarettes. Now he's smoking CBD. I think we talked about this behind stage, but coming off other drugs, we talked about morphine and those things. Can it be used as a recovery drug from cocaine, perhaps?
So there's a couple studies out of the VA hospital where they're not only looking at using cannabis to help veterans with PTSD, but they're also looking at it as a ways to alternative to certain drugs. So it's being looked at as an alternative, and even in Illinois, we have the Alternative Opiate Act. So you could literally prescribe cannabis to help get people off of opiates. as an alternative to opiates, and that's something that's sanctioned by Illinois state government. So, whether or not, so again, cannabis is definitely safer than cocaine use.
Yeah, that's. I think we can all agree on that. Real quick, I think Pat had a couple of questions. She had the question about the topical versus oral, and she has I think the topical use for psoriasis, and then she asked if CBD is an adaptogenic agent. So if y'all can address those two quickly as we sign off tonight, particularly an adaptogenic agent. I mean, we use other natural foods as adaptogens. Is that CBD oil can enhance adrenal gland function, or like other adaptogenic agents, or not enough data on that, right?
Yeah, well, it's complicated, and I've also seen CBD oil done in context of other established adaptogens like ashwagandha. So there's a lot of different companies that are combining different oils, including CBD, but again, like I said, stuff like ashwagandha to really enhance that adaptogenic effect. Wow.
Well, everybody, look, this has been a wonderful show. I tell you, thank you very much. We're going to have to do next week. We'll post a show between tonight and tomorrow. Next week, we'll be talking about the application of it. We have guests who will be on talking about the applications in the form of the market, where it's bought, how it's used. We'll have a chef that uses cannabis, as well as an organization that works with educational programs. And so you want to stay tuned. We want to connect the dots here. And even though this is a two-part series, we may bring this topic back later on this year, or early part of next year, because I have a notebook full of notes here, but I think I've generated many more questions and notes. So I'm going to give, let's all in the chat center, those who are there, give us a digital applause to Dr. Ed Mcdonald and Dr. Carly Biggins for an excellent presentation, educational show tonight. And I think it's going to affect my practice. I'm going to have to do some reading. So Dr. Biggins, I'll be calling you, both of you, I'll be calling you, asking for some articles and the like, because I have a lot of patients just listening to this conversation that I know will very likely benefit from this. So I know we went over, but I think it was worth the time. But again, give us a digital applause in the studio as I close this out. I'll see you guys backstage. And so again, it's been a wonderful a Monday evening. And, again, this whole concept of marijuana, I will have to be honest, I was really a staunch advocate against it in the sense that it was always taboo to me growing up. And so that was something that was kind of baked in my inner bones, if you will. And so when I heard about the legalization of marijuana, and I have one son that's experimented with it, and again, still, I've gotten my arms around it, but of course, insight and knowledge helps you with this, and that's what we hope to bring to you in this show in general, and particularly with the episode we had tonight. So I hope this is very entertaining and helpful to you. We also want to encourage you to please subscribe and like if you found this to be helpful. Share this with your friends. I think this is very informative information. There are a lot of people buying CBD oil, and you have to understand what you're dealing with. We do have programs online nutritional bootcamp class that those you need help with making lifestyle changes, you can go there. And of course, any questions that you have, you send it to us at wellness@montgomeryheart.com. And we will then generate these questions and get it on the station and try to answer it. So again, as always, it's been a wonderful Monday evening. We want you to keep it fresh, natural, and live. And we will see you next Monday evening. So take care and have a great week.